Welcome to this edition of Clinical Clips, an accredited continuing education activity. This brief expert video will spotlight the daily hot topics from the conference.
Hello, I am Dr. Amasika Niaku, an assistant professor at Northwestern University Feinberg School of Medicine, and I'd like to welcome you to Clinical Clips from IAS 2025, and this is episode 1 of 4. So I'm going to take you through some of the oral abstracts that were presented today. And so first, we're going to start with a double-blind, active-controlled phase 2b study to evaluate the efficacy and safety of ulonivirine in combination with islatravir in virologically suppressed adults living with HIV-1. This is a study to evaluate the safety and virologic efficacy of switching from suppressive 3-drug ART to islatravir 20 milligrams combined with different doses of ULO at either 100 milligrams, 200 milligrams, and 400 milligrams as a once-a-week treatment regimen. ULO is a new generation non-nucleoside reverse transcriptase inhibitor that has potent antiviral activity in the presence of common non-nuc resistance mutations. In terms of virologic efficacy, weekly treatment at all 3 doses of islatravir plus ULO maintained virologic suppression compared to BIC-FTAF, and there was no confirmed virologic failures. However, the study was stopped early because of decreased total lymphocytes and CD4 counts. Reassuringly, there were lymphocyte and CD4 count recovery after discontinuation. In terms of other adverse events, those were comparable across the groups and similar to the AEs that were seen in the BIC-FTAF group. So this combination of islatravir and ULO remains a promising new ART strategy. The next steps, though, are to optimize the dosing to maintain the virologic efficacy and reduce the lymphopenia. And so there's a new phase 2b study that's going to evaluate the virologic efficacy and safety of using lower doses. And this will be islatravir 2 milligrams and then the ULO at 200 milligrams, first as a once daily preparation, and then the manufacturer will go from there. Next, I want to talk to you about another abstract. So this is the first experience of dual antiretroviral maintenance regimen in West and Central Africa compared with continuing 3-drug current antiretroviral regimens. Week 96 results from the Moderados trial. So this study evaluated switching to 2-drug, either dolutegravir with lamivudine or atazanavir, boosted atazanavir with lamivudine versus 3-drug regimen in regions in Central and West Africa, specifically Cote d'Ivoire, Burkina Faso, or Cameroon, in individuals with HIV virologic suppression. In terms of virologic efficacy, 2-drug regimens, either of those, were non-inferior to continuing on a 3-drug regimen. There was 3.1% virologic failure in both of the 2-drug regimen arms as compared to 2.5% in the 3-drug arms, which again was non-inferior. In terms of the adverse events, those were comparable across the groups, except there was more weight gain in the 2-drug arms compared to tenofovir, lamivudine, efavirenz. Overall, this study is important because data on switch to 2-drug therapy in Western and Central Africa is limited, and the positive findings from this study will help to inform global treatment guidelines. Next, I'll take you through another oral abstract. So this was the real-world effectiveness of cabotegravir and rilpivirine long-acting in individuals with HIV viremia at therapy initiation. The OPERA cohort represents 150,000 people living with HIV in the United States, which is approximately 14% of the total population of people living with HIV in the United States. And this study evaluated the adherence, persistence, and effectiveness of long-acting cabotegravir and rilpivirine in individuals with detectable viral loads. Of those that either received the once-a-month or 2-month injection, every 2-month injections, 59% had on-time injections, and 13% missed 1 injection. In terms of the duration on therapy, it was a median of 12 months, and that interquartile range was from 8 to 19 months. And in terms of the virologic efficacy of those that had completed induction, 85% achieved an undetectable viral load within 6 months, and only 1% had confirmed virologic failure. And that represented 2 in the once-a-month dosing regimen and 1 individual in the every 2-month dosing. Overall, all 3 of the individuals were able to get on a suppressive regimen. The results of the OPERA study add to the evidence base about the use of long-acting cabotegravir rilpivirine in people with HIV with detectable HIV viral loads, with the caveat that in this cohort study, it was the level of viremia was relatively low. Next, I'll take you through another oral abstract. It was promising new therapeutic options for HIV, next generation HIV-1 investigational protease cleavage site, also known as maturation inhibitor HRF 10071, phase 2 results. So this is a phase 2A monotherapy study of the virologic activity of 14 days of HRF 10071. And so going forward, I'll just say HRF 71. And so this is a new maturation inhibitor. 30 participants were enrolled and there were 5 arms. So the dosing was 20 milligrams, 30 milligrams, 40, and 80 milligrams. And there was also a placebo arm. In terms of the virologic activity of 14 days of HRF 71, there was a statistically significant decrease in all of the HRF 71 arms. In terms of the adverse events, those were mainly mild, and none of them were attributed to the study product, and there were no serious adverse events. 3 of the 30 participants did develop resistance to HRF 71, and the resistance mutations were similar to the treatment emergent resistance mutations in other maturation inhibitor studies. Overall, this is a very exciting finding, and more development is planned with the potential to evaluate HRF 71 as a long-acting formulation. Last but not least, I want to talk about another oral abstract, and this is long-acting injectable antiretroviral therapy safe in countries with high hepatitis B prevalence? Insights from the Impala study. So this is a sub-analysis of the Impala study. So the primary Impala study evaluated the efficacy of long-acting cabotegravir and rilpivirine as compared to dolutegravir with 2 nucleoside reverse transcriptase inhibitors in individuals with non-suppressed HIV or in individuals that had a history of loss to follow-up or poor linkage to HIV care. In this sub-analysis, they wanted to answer 3 questions. What is the prevalence of hepatitis B? What is the incidence of hepatitis B reactivation? And what is the incidence of elevation in liver function tests? The first question, what is the prevalence of hepatitis B? During screening, they had 36% of individuals had hepatitis B core antibody positivity. And of those, so that was 300 individuals, 168 also had hepatitis B surface antibody positivity. In terms of the clinical evidence of hepatitis B reactivation, there were no instances of hepatitis B reactivation, but there was 1 incidence of new hepatitis B infection. Additionally, in those individuals that had hepatitis B surface antibody positivity, as well as hepatitis B core antibody positivity, they evaluated for evidence of elevations in liver function tests, which potentially could indicate some level of hepatitis B reactivation. And overall, this was an infrequent occurrence. And so taken together, the risk of hepatitis B reactivation in a carefully screened population is quite low. And so though the background prevalence of hepatitis B may be overall high in sub-Saharan Africa, this should not preclude evaluating individuals for switching to long-acting cabotegravir rilpivirine in the setting of screening for chronic hepatitis B. And so with that, I'd like to close. Thank you for joining us for episode 1. Please refer to the landing page for slides and to claim your continuing education credit. Please be sure to come back tomorrow for our second clinical clip from IAS 2025.
We hope you found this activity useful and educational. To receive continuing education credit and to download your printable certificate, please return to the activity webpage and click on the Claim Credit button associated with today's clinical clip.